So within the guidelines, we actually did bring together a grouping of myths and misconceptions. One of the big ones is that dental pain doesn't hurt. And we see that, and Kymberley, I'll let talk a little bit more. We see that people say, well, it doesn't hurt the dog, he's eating. And so that's a big misconception out there among veterinarians. And we had to convince board certified specialists that broken teeth hurt. So I'll let you take that part.
I think one of the biggest lacks that we have right now, one of the biggest needs that we have in the veterinary community is understanding how pain actually affects our animals and how they show it to us. When we don't know what pain looks like in an animal, how can we say whether it's there or not? Dentistry is an area that we know in comparative species, whether it's rodents or human beings, fractured teeth, infected gums, even simply impacted gums. I think most people have experienced some piece of a popcorn kernel that's been stuck for a number of days. That develops a slow ache over time. And yet for a dog or a cat who doesn't know how to show that pain to its owner, or an owner who doesn't know how to interpret it, or a veterinarian who sadly has been told that, well, if something hurts, an animal would stop eating, they assume that the nourishment going in equals a lack of pain. What we're finding more and more as a combination of specialists start to look into these things more is that our animals do show us pain, but they show us pain in ways that maybe we wouldn't expect.
Right.
That animals eat to survive. It's a survival drive. Animals avoid pain for convenience. So they will eat no matter what. They will. And sadly, what we find is often when animals stop eating, veterinarians will think it's a dental problem and it's something systemic. So what we're trying to help with the guidelines is for veterinarians to understand that they need to address these myths, these misperceptions that a broken tooth or an infected tooth doesn't hurt. Take the pain away. What we then find is a client will report, wow, you gave me my dog back. He's acting like a puppy again. And then they see the big changes. And we think, well, but the changes were slow on the first side, but if we can help veterinarians to understand those, we can help them to advocate for their patients.